Question 1. Which of the following is the first step in the decontamination process of surgical instruments? A. Sterilization. B. Manual cleaning. C. Disinfection. D. Point-of-use cleaning and sorting. Answer: D. Point-of-use cleaning and sorting. This question tests your knowledge of the initial phase of instrument processing. The keyword first step emphasizes the very beginning of the cycle after a procedure. Point-of-use cleaning, often done in the operating room, involves wiping gross soil from instruments and keeping them moist to prevent bioburden from drying, which is critical for effective later cleaning. This initial action prevents stubborn stains and makes subsequent manual or automated cleaning much more efficient. Think of it as pre-treating a dirty dish right after use to make washing easier. Always remember that immediate care at the point of use significantly impacts the success of the entire decontamination process. Question 2. What is the primary purpose of a Bowie-Dick test? A. To test the efficacy of biological indicators. B. To detect air leaks and ensure proper air removal in a dynamic air removal steam sterilizer. C. To measure the temperature inside the sterilizer chamber. D. To confirm the sterilization cycle time. Answer: B. To detect air leaks and ensure proper air removal in a dynamic air removal steam sterilizer. This question focuses on a crucial quality control test for steam sterilizers. The keywords Bowie-Dick test and primary purpose direct you to its specific function. A Bowie-Dick test is performed daily in dynamic air removal, pre-vacuum, steam sterilizers to verify that all air is effectively removed from the chamber, allowing steam to penetrate correctly. If air remains, it creates cold spots where sterilization cannot occur. For example, if the test fails, it indicates an issue like an air leak or vacuum pump malfunction that must be corrected before instruments can be safely sterilized. Always remember that a successful Bowie-Dick test is essential for ensuring the reliable operation of pre-vacuum steam sterilizers. Question 3. What personal protective equipment, PPE, is generally required when handling contaminated instruments in the decontamination area? A. Surgical mask and scrubs only. B. Fluid-resistant gown, gloves, mask, and eye protection. C. Clean lab coat and safety glasses. D. N95 respirator and sterile gloves. Answer: B. Fluid-resistant gown, gloves, mask, and eye protection. This question assesses your understanding of safety protocols in the high-risk decontamination area. The keywords PPE and contaminated instruments highlight the need for comprehensive protection against splashes and aerosols. Wearing a fluid-resistant gown, sturdy gloves, a mask, and eye protection creates a barrier between you and potential microorganisms, preventing exposure through skin, mucous membranes, or inhalation. For instance, if a sharp instrument splashes contaminated fluid, your PPE acts as the first line of defense. Always prioritize your safety by wearing the correct and complete PPE every time you enter the decontamination area. Question 4. Which organization establishes the standards for steam sterilization practices in healthcare facilities? A. Occupational Safety and Health Administration, OSHA. B. Environmental Protection Agency, EPA. C. Association for the Advancement of Medical Instrumentation, AAMI. D. The Joint Commission, TJC. Answer: C. Association for the Advancement of Medical Instrumentation, AAMI. This question asks about the authoritative body for sterilization standards. The keyword Standards for Steam Sterilization Practices points directly to AAMI, which develops comprehensive guidelines for the processing of medical devices. While other organizations play roles in safety or accreditation, AAMI specifically creates the technical standards that central service departments follow for sterilization and other processing steps. For example, AMI ST79 is a key resource detailing recommended practices for steam sterilization. Always remember AAMI is the go-to source for detailed guidelines on how to properly sterilize medical instruments. Question 5. What is the acceptable temperature range for the decontamination area? A. 60 degrees Fahrenheit to 65 degrees Fahrenheit, 16 degrees Celsius to 18 degrees Celsius. B. 68 degrees Fahrenheit to 73 degrees Fahrenheit, 20 degrees Celsius to 23 degrees Celsius. C. 75 degrees Fahrenheit to 80 degrees Fahrenheit, 24 degrees Celsius to 27 degrees Celsius. D. 55 degrees Fahrenheit to 60 degrees Fahrenheit, 13 degrees Celsius to 16 degrees Celsius. Answer: A. 60 degrees Fahrenheit to 65 degrees Fahrenheit, 16 degrees Celsius to 18 degrees Celsius. This question tests your knowledge of environmental controls in the Central Service Department, specifically for the decontamination area. The keywords acceptable temperature range and decontamination area are crucial. Keeping the decontamination area cooler, typically between 60 degrees Fahrenheit and 65 degrees Fahrenheit, helps to inhibit microbial growth on contaminated items and makes it more comfortable for staff wearing extensive PPE. For example, a cooler environment reduces the likelihood of staff becoming overheated while performing physically demanding tasks. Remember that proper environmental controls are vital for both instrument integrity and staff comfort and safety. Question 6. How often should sterilizer biological indicators, BICE, be performed for routine monitoring of steam sterilizers? A. Daily, or at least weekly if the sterilizer is not used daily. B. With every load. C. Once a month. D. After every repair or maintenance. Answer: A. Daily, or at least weekly if the sterilizer is not used daily. This question assesses your understanding of routine biological monitoring for steam sterilizers. The keywords how often and routine monitoring are key. Biological indicators, which contain resistant bacterial spores, are performed daily in steam sterilizers, or at least weekly if the sterilizer is not used every day, to provide the highest level of assurance that the sterilization process is effective. For example, if a daily BI fails, it immediately flags a problem with the sterilizer, preventing unsterile instruments from being used. Remember that daily BI testing is a critical safety measure to confirm sterilization efficacy. Question 7. What type of water should be used for the final rinse of instruments after cleaning and before sterilization? A. Tap water. B. Distilled water. C. Deionized (DI) water. D. Sterile water. Answer: C. Deionized (DI) water. This question focuses on the quality of water used in instrument processing, which is vital for preventing instrument damage and ensuring effective sterilization. The keywords final rinse and before sterilization indicate the importance of removing impurities. Deionized water is preferred for the final rinse because it has had mineral ions removed, which prevents spotting, staining, and the accumulation of mineral deposits on instruments that could interfere with sterilization or cause corrosion. For example, using tap water for the final rinse might leave mineral residue that could damage delicate instruments over time. Always remember that deionized water helps protect instruments and ensures they are truly clean and ready for sterilization. Question 8. The term shelf life for a sterile package refers to: A. The amount of time the package can be stored before it expires. B. The date the package was sterilized. C. The amount of time the package remains sterile under specified storage conditions. D. The duration of the sterilization cycle. Answer: C. The amount of time the package remains sterile under specified storage conditions. This question tests your understanding of sterility maintenance. The keyword shelf life in the context of sterile packages means how long an item can be considered sterile, provided it remains intact and dry in its packaging, and is stored properly. It's not a fixed expiration date based on time alone, but rather an event-related concept where sterility is maintained until an event compromises the package integrity, such as being torn or wet. For example, a package remains sterile until it's dropped and the seal breaks. Always remember that shelf life is dependent on package integrity and proper storage, not just a calendar date. Question 9. What is the purpose of enzymatic detergents used in manual and automated cleaning of instruments? A. To disinfect instruments. B. To break down proteins, fats, and carbohydrates. C. To remove hard water stains. D. To lubricate instruments. Answer: B. To break down proteins, fats, and carbohydrates. This question focuses on the specific action of enzymatic detergents in the cleaning process. The keyword enzymatic is a strong clue, referring to enzymes. Enzymatic detergents contain enzymes that specifically break down organic material like blood, proteins, tissue, fats, and carbohydrates, and other bioburden, making it easier to rinse away. For instance, these enzymes act like tiny biological scissors, cutting up the tough-to-remove gunk so the cleaning process is more effective. Remember that enzymatic detergents are crucial for effectively removing bioburden before disinfection or sterilization. Question 10. When assembling instrument sets, which of the following is most important for proper sterilization? A. Placing heavy instruments at the bottom of the tray. B. Keeping instruments closed to prevent damage. C. Ensuring instruments are correctly counted and arranged according to the count sheet. D. Using instrument stringers or racks to keep hinged instruments open. Answer: D. Using instrument stringers or racks to keep hinged instruments open. This question addresses a critical aspect of instrument preparation for sterilization. The phrase, most important for proper sterilization, highlights a factor directly affecting steam penetration. Hinged instruments, like scissors or clamps, must be kept open using stringers or racks to allow steam to reach all surfaces, including the box locks, ensuring proper sterilization. If they are closed, steam cannot penetrate effectively, leading to potential sterilization failures. For example, leaving a closed hemostat in a tray would create an area where microorganisms could survive. Always remember that opening hinged instruments is vital for successful steam sterilization. Question 11. What is the typical relative humidity range for the sterile storage area? A. 20% to 30%. B. 30% to 40%. C. 30% to 60%. D. 60% to 70%. Answer: C. 30% to 60%. This question tests your knowledge of environmental conditions for maintaining sterility. The keywords relative humidity range and sterile storage area are key. Maintaining a relative humidity between 30% and 60% in the sterile storage area is crucial because it helps prevent condensation, which can compromise sterile packaging, and also inhibits excessive drying, which could make packaging brittle. For instance, if humidity is too high, condensation could form inside packages, making them unsterile, while too low humidity could dry out and damage wraps. Remember that proper humidity control is essential for maintaining the integrity of sterile packages until use. Question 12. What is the main risk associated with wet packs after a steam sterilization cycle? A. Instrument corrosion. B. Damage to the sterilizer. C. Compromised sterility. D. Difficulty in handling. Answer: C. Compromised sterility. This question highlights a significant concern related to steam sterilization outcomes. The keywords main risk and wet packs direct you to the most critical consequence. Wet packs are a major concern because moisture can wick bacteria from the outside environment through the packaging material to the instruments inside, rendering them unsterile. For example, if a sterile package comes out wet, it acts like a sponge, drawing in contaminants and losing its sterility. Always remember that a wet pack means a non-sterile pack, and it must be reprocessed. Question 13. Which of the following is an example of an immediate-use steam sterilization (IUSS) item? A. An implantable device that is routinely sterilized in a full cycle. B. A single instrument dropped on the floor during a procedure that is urgently needed. C. A large instrument set that is typically processed overnight. D. Any instrument that has been pre-cleaned and dried. Answer: B. A single instrument dropped on the floor during a procedure that is urgently needed. This question tests your understanding of immediate-use steam sterilization, a practice that should be limited. The keywords immediate-use steam sterilization, IUSS, and example prompt you to identify a scenario where rapid processing is necessary due to urgent need, not convenience. IUSS is typically used only when there's an urgent need for an unwrapped item and no time for conventional sterilization, such as a dropped instrument during a critical surgery. It's important to understand that IUSS is not a substitute for conventional sterilization and should be an exception, not a routine. Remember that IUSS is for emergencies when there is no other sterile option available immediately. Question 14. What is the primary reason for performing a leak test on flexible endoscopes? A. To check for electrical conductivity. B. To detect damage to the scope's outer sheath that could lead to fluid invasion. C. To measure the scope's light intensity. D. To confirm the scope's internal channel patency. Answer: B. To detect damage to the scope's outer sheath that could lead to fluid invasion. This question focuses on a vital quality assurance step for flexible endoscopes. The keywords leak test and flexible endoscopes are crucial. A leak test is performed to identify any tiny holes or tears in the scope's outer sheath that could allow fluids, like water or cleaning solutions, to enter the internal components, causing extensive and costly damage or creating areas where bioburden can hide. For example, if a leak is present, water from cleaning could get inside the scope and corrode delicate electronics. Always remember that a leak test protects the valuable endoscope and ensures its functionality. Question 15. What is the recommended method for cleaning the internal lumens of complex instruments such as laparoscopic instruments? A. Wiping with a cloth. B. Soaking in disinfectant solution. C. Flushing with appropriate cleaning solutions and brushing. D. Using an ultrasonic cleaner only. Answer: C. Flushing with appropriate cleaning solutions and brushing. This question addresses the specific challenge of cleaning instruments with internal channels. The keywords recommended method and internal lumens indicate the need for a thorough cleaning technique. To effectively remove bioburden from lumens, you must flush them with cleaning solutions and physically brush the inside channels to dislodge debris. Simply wiping or soaking will not adequately clean these difficult-to-reach areas. For instance, imagine trying to clean the inside of a straw without flushing or brushing. It's nearly impossible to get it truly clean. Always remember that lumens require direct flushing and brushing for effective cleaning. Question 16. What is the purpose of a chemical indicator, CI, used on or in instrument packs? A. To confirm instrument sterility. B. To demonstrate exposure to a specific sterilization process. C. To measure the exact temperature inside the sterilizer. D. To identify the type of instruments in the pack. Answer: B. To demonstrate exposure to a specific sterilization process. This question tests your understanding of chemical indicators in sterilization quality assurance. The keyword purpose of a chemical indicator is key. chemical indicators respond to one or more parameters of the sterilization process, e.g., steam, temperature, time, by changing color, indicating that the item was exposed to the sterilization conditions, but they do not confirm sterility itself. For example, an external indicator on a package confirms it went through the sterilizer, while an internal indicator verifies sterilant penetration within the package. Remember, chemical indicators provide a quick visual check that conditions were met, but only biological indicators confirm spore kill. Question 17. Which of the following is generally not recommended for use as a sterile packaging material? A. Woven textile wraps. B. Spun-bond polyolefin wrappers. C. Paper plastic pouches. D. Non-woven fabric from recycled materials. Answer: D. Non-woven fabric from recycled materials. This question asks about appropriate sterile packaging materials. The phrase "not recommended" and "sterile packaging material" focuses on what is unsuitable. While various materials are used for sterile packaging, those made from recycled materials, unless specifically validated and approved for medical device sterilization, are generally not recommended because their barrier properties and integrity cannot be consistently guaranteed for maintaining sterility. Packaging must meet specific standards for porosity, strength, and barrier effectiveness to prevent microbial contamination. For example, regular paper from a recycling bin would never be used for sterile packaging because its barrier properties are unknown. Always select packaging materials that are specifically designed and validated for medical device sterilization. Question 18. What is the primary function of a washer disinfector in the Central Service Department? A. To sterilize instruments. B. To manually clean instruments. C. To mechanically clean and thermally disinfect instruments. D. To store sterile instruments. Answer: C. To mechanically clean and thermally disinfect instruments. This question tests your understanding of automated instrument processing equipment. The keywords primary function and washer disinfector are important. A washer disinfector uses mechanical action, sprays, detergents, and high temperatures, thermal disinfection, to thoroughly clean instruments and reduce the number of microorganisms, preparing them for sterilization. It provides a more consistent and safer cleaning process than manual methods. For instance, after being cleaned in a washer disinfector, instruments are typically safe to handle without full PPE, though they are not yet sterile. Remember, a washer disinfector is a key step in removing bioburden and making instruments safe for further handling. Question 19. If an instrument set has a torn wrapper, what is the appropriate action to take? A. Repackage the set immediately. B. Use the set if the tear is small. C. Consider the set contaminated and reprocess it. D. Disinfect the outside of the wrapper and use. Answer: C. Consider the set contaminated and reprocess it. This question addresses the critical principle of maintaining sterility. The keywords torn wrapper and appropriate action signify a breach in the sterile barrier. Any breach in sterile packaging, regardless of size, compromises the sterility of the contents because microorganisms from the environment can enter. Therefore, the set must be considered contaminated and completely reprocessed through the entire cleaning, packaging, and sterilization cycle. For example, even a tiny pinhole can allow bacteria to pass through, making the instruments unsafe for patient use. Always remember, if packaging integrity is compromised, consider it contaminated and reprocess from scratch. Question 20. When should biological indicators be incubated and read after a sterilization cycle? A. Immediately after the cycle for 24 to 48 hours. B. Within 2 hours of the cycle for 24 to 48 hours. C. After 24 hours of cooling. D. Only if the chemical indicator fails. Answer: B. within 2 hours of the cycle for 24 to 48 hours. This question focuses on the correct procedure for processing biological indicators. The keywords incubated and read and after a sterilization cycle are key. Biological indicators should be placed in an incubator as soon as possible, ideally within 2 hours after the sterilization cycle, to ensure accurate and timely results. The incubation period typically lasts 24 to 48 hours, depending on the type of BI, allowing any surviving spores to grow and indicate a sterilization failure. For example, delaying incubation could lead to inaccurate results or a delay in detecting a sterilizer malfunction. Remember to incubate BIs promptly to get reliable results quickly. Question 21. What is the correct way to transport contaminated instruments from the operating room to the decontamination area? A. In an open tray on a cart. B. In a sealed or covered container. C. Wrapped loosely in a surgical towel. D. Carried by hand by a staff member. Answer: B. In a sealed or covered container. This question addresses safety and infection control during the transport of soiled items. The keywords correct way to transport and contaminated instruments emphasize the need to contain potential hazards. Contaminated instruments must always be transported in a closed or covered container to prevent exposure to staff, patients, and the environment from spills, aerosols, or direct contact with blood and other body fluids. For example, using a lidded cart or basin prevents accidental exposure during transport. Always remember that proper containment of contaminated items is crucial to prevent healthcare-associated infections. Question 22. Which sterilization method is typically used for heat-sensitive and moisture-sensitive instruments? A. Steam sterilization. B. Ethylene oxide, EO, sterilization. C. Dry heat sterilization. D. Flash sterilization. Answer: B. Ethylene oxide, EO, sterilization. This question tests your knowledge of different sterilization modalities and their appropriate uses. The keywords heat-sensitive and moisture-sensitive are crucial clues. Ethylene oxide, EO, sterilization is effective at lower temperatures and without moisture, making it suitable for delicate instruments, plastics, and electronics that cannot withstand the high heat and steam of traditional autoclaves. For example, many complex medical devices with integrated circuits might be damaged by steam, making EO a preferred method. Remember that EO is a common choice for items that would be ruined by heat or water. Question 23. The function of an ultrasonic cleaner is to A. Sterilize instruments using sound waves. B. Disinfect instruments with high-frequency vibrations. C. Loosen soil from instruments using cavitation. D. Dry instruments quickly after manual cleaning. Answer: C. Loosen soil from instruments using cavitation. This question focuses on the mechanism of action for a common cleaning device. The keywords ultrasonic cleaner and function point to its specific cleaning method. An ultrasonic cleaner uses high-frequency sound waves to create microscopic bubbles that implode, cavitation, on instrument surfaces, effectively dislodging stubborn soil from intricate areas and lumens. It cleans, but it does not sterilize or disinfect. For example, tiny crevices in instruments that are hard to reach with a brush are effectively cleaned by this process. Always remember that ultrasonic cleaners are excellent for cleaning, but instruments still require disinfection and sterilization afterward. Question 24. What is the primary goal of surgical instrument inspection after cleaning? A. To count instruments for the next case. B. To identify any instruments that are missing. C. To ensure cleanliness, proper function, and integrity before sterilization. D. To determine if the instruments need lubrication. Answer: C. To ensure cleanliness, proper function, and integrity before sterilization. This question highlights a crucial step in the preparation area. The keyword primary goal and instrument inspection after cleaning emphasize the comprehensive check performed before packaging. After cleaning, every instrument must be meticulously inspected to ensure it is visually clean, free of damage, operates correctly, e.g., scissors cut cleanly, clamps close properly, and is in good repair. This step is vital because even tiny bits of bioburden can lead to sterilization failure, and damaged instruments can harm patients. For example, checking a pair of scissors to ensure the blades align and are not dull ensures they will perform as expected in surgery. Always remember that thorough inspection is key to patient safety and successful sterilization. Question 25. What does the term bioburden refer to in the context of instrument processing? A. The weight of the instrument set. B. The type of metal an instrument is made from. C. The number of microorganisms on an inanimate object. D. The amount of disinfectant used during cleaning. Answer: C. The number of microorganisms on an inanimate object. This question asks for a fundamental definition in infection control. The term bioburden is a critical concept in central service. It refers to the number of viable, living, microorganisms contaminating an object before sterilization or disinfection. The higher the bioburden, the more challenging it is to achieve sterility, as the sterilization process must eliminate all of these organisms. For example, instruments fresh from surgery have high bioburden due to blood and tissue, necessitating thorough cleaning. Remember, effective cleaning reduces bioburden, making subsequent sterilization processes more effective and reliable.